The title of this project is Wastewater Surveillance and the Copula Time Series Modeling for Monitoring COVID-19 Cases and the Trends. Wastewater surveillance has served as a complement to clinical and individual-based surveillance for monitoring COVID-19 outbreaks. Wastewater COVID-19 viral load has been applied to monitor the epidemiology of viral infections, to trace the circulations of a virus in both asymptomatic or symptomatic infected individuals, and third, identify hotspots in the communities. To seize the national efforts in managing the COVID-19 pandemic, the U.S. Centers for Disease Control Prevention has established a national wastewater surveillance system to track COVID-19 cases and overall infection trends. Virginia was selected to be part of the surveillance systems. Our project was funded by the CDC grant, and particularly to monitor COVID-19 cases at the city and community level. Currently, a total of 35 wastewater treatment facilities has participated in Virginia statewide wastewater surveillance. Our project is located in the Hampton Roads area in the southeast part of Virginia. Localized projects aim to monitor COVID-19 at the city and community level, to identify COVID-19 hotspots in the communities, depict specific trends of COVID-19 cases, and most importantly, developed a forecast model to predict COVID-19 using wastewater SARS-CoV-2 viral concentration and loads. Through the project, we have built a robust partnership in networking. The team from Old Dominion University, VDH Office of Environmental Health Services, local health departments, Hampton Roads Sanitation District, and the local Department of Utilities are responsible for conducting the project. The work group includes the team and stakeholder members who have met once 2 to 3 weeks to review project approaches and data interpretation data and recommend strategy for prevention to the local health departments. The local health departments utilize the information from the project to develop prevention strategies and priorities and to communicate the public. We have collected wastewater samples from pumping stations in selected communities. Here is an example of sampling locations in the 3 communities. The sites were selected based on population, the numbers of schools, restaurants, and daycare centers. Wastewater samples were collected once per week from the selected pumping stations. Wastewater SARS-CoV-2 antigen copies per 100 ml was qualified by the reverse transcription droplet digital PCR. And then wastewater SARS-CoV-2 viral load was determined by timing the SARS-CoV gene concentrations with the wastewater pumping values. Local health departments have provided reported COVID-19 cases, hospitalization cases, and death cases from local health departments. We link both environmental and clinical data and assess this method data using the predicted mean match methods of multiple imputation by chance equations. The innovative approach of this project was to construct the forecast models called Gaussian copula marginal regression time series models. The model integrates both the ARMA models and the copula function. As COVID-19 cases are time-dependent, the ARMA model was used for time series analysis to understand the marginal distributions of both dependent and independent variables. The ARMA model includes two components, autoregression component and moving average. The autoregression component consists lagging of a change in variable regression, while a moving average component incorporates the dependencies between an observation and residual errors from a moving average models applied to latent observations. Both Poisson distribution regression and negative binomial discretion regression were considered in the ARMA models. Once the ARMA models select the optimal conditions for AR and MA components, the ARMAs was integrated with copula functions, which is the joint distributions of the random variables with respected marginal cumulative distribution function. We validate the models using many different ways, including the ARC information criteria for assessing the strength of dependence, QR plots, residual plots, partial autocorrelation functions. The lower AIC indicate a good models. The robustness of the models was assessed by the outcomes with and without missing models. The maps show the distributions of wastewater source COVID-19 viral concentration in a selective community in a time series fashion. The baseline of wastewater source COVID viral concentrations were detected. Wastewater SARS-CoV viral concentrations increased in a populated neighborhood initially and then gradually spread to other neighborhoods. The map shows the distributions of wastewater SARS-CoV-19 to viral concentration in another selected community. Like a previous community, increased wastewater SARS-CoV-2 viral concentration were observed. However, the patterns of spread was different from other. It highlights the importance of detected wastewater SARS-CoV-19 viral concentration in the community to reflect accurate COVID-19 distributions. We tested various combinations of AR and MA polynomials for the AR models. Based on IICs and the significance correlation coefficients, the combination of 1 and 1 for Q and P of AR and MR components yield the optimal conditions for the ARMA models. ARMA 11 was used to integrate with the copula function. The slide shows the model validation. Residual QQ ACA plots show validation of ARMA model, For example, the residual plots were within a narrow interval range. QQ plots were 45 degrees angle lines. ACL, PACL plots showed stationary time series signals. That was confirmed by the augmented Deakin Fuller tested. The figure shows the reported cases in blue lines and the forecast COVID-19 cases in green lines. The forecast cases trend was held under the Gaussian copula marginal regression time series models with the Poisson distributions. The green area shows the 99% confidence interval. The trend generated from the model prediction was suited to the general trend of reported COVID-19 cases. More than 80% of predicted cases fall within the 99 confidence interval range. The model had over dispersion prediction and the smaller variations. That may be a result of over-content COVID-19 cases. The figure shows the superposed plots of the forecast and the reported COVID-19 cases under negative binomial regression distribution. The model also performed well, since the trend of the forecasted cases follow well with the reported cases. Among the two regression models, the Poisson distribution performed better than the negative binomial distributions. We observed some major findings from these studies. Wastewater SARS-CoV-2 viral concentration were correlated with COVID-19 cases and hospitalization cases, but wasn't correlated with death cases. Poisson ARMA 101 was selected for the ARMA model as the best fit of all. In both model prediction, a measure of COVID-19 cases in the 99 confidence interval and the reported cases during the entire study period. The project is ongoing, and we plan to increase models' effectiveness and accuracies by increasing the data size, increasing sampling intervals from the pumping stations from 1 per week to 2 per week, and including related variables such as demographics, socioeconomic determinants, and vaccination conditions. Finally, we will take into account of seasonal impact for the ARMA models. Overall, the project has made a significant impact. As I previously mentioned, the team and work group has met regularly and provide recommendations to the local health departments. The project has contributed to the trajectory of community health at the local level with science, equity, and trust. Thank you.